These are the points I'm going to cover this morning. I'm going to briefly review COVID-19 disparities in Ohio. Then I will talk about the connections between racism and health. And then on action steps that can be taken to dismantle racism. In the past, I have shared the many troubling racial and ethnic disparities experienced by communities of color, even prior to the pandemic. On average, Black Ohioans were expected to live 4 years less than white Ohioans. That continues. And a measure that has continued to elude us as a state and is even more disturbing is that Black infants in our state are dying at a rate that is 2.5 times greater than the rate for white infants and 2 times greater than the state's overall rate for infant mortality. The health disparities and inequities experienced by communities of color have really only exacerbated gaps in outcomes during the COVID-19 pandemic. And this figure is from our COVID-19 disparities brief. It's been updated and compares COVID-19 cases, hospitalizations, and deaths for Black and white Ohioans relative to their proportions of the state's total population. What this shows is that our Black community in Ohio is overrepresented in COVID-19 cases, hospitalizations, and deaths. So for example, Black or African American Ohioans account for 14% of our state's population, but make up more than 26% of COVID-19 hospitalizations. On the other hand, white Ohioans make up about 83% of the state's population, but less than 61% of COVID-19 hospitalizations. Another troubling data point is that Black or African American Ohioan COVID-19 deaths have already surpassed total deaths in 2018 from several other leading causes. And with these numbers only increasing, COVID-19 is likely to become a top 3 leading cause of death for Black or African American Ohioans in 2020. The impacts of COVID-19 have only emphasized that we are moving in the wrong direction, and the gaps in outcomes we have been seeing for communities of color will only widen. When we talk about COVID-19 disparities, like the many other disparities experienced by communities of color in Ohio, they really are just the tip of the iceberg. They're indication of more deep-seated issues that need to be rectified, and the research evidence is clear that racism is a primary driver of the inequities and disparities experienced by communities of color. Before I go further, I want to pause to emphasize that the gaps in outcomes faced by Ohioans of color, and specifically by our Black and African American community around COVID-19 and other health outcomes, are not a result of differences in behaviors or genetics. The evidence is clear and demonstrates that these gaps in outcomes are the result of hundreds of years of racist policies, practices, systems, and beliefs. The link between racism and health is grabbing the nation's attention, as we've heard referenced throughout our meeting this morning. And as we see how COVID-19 is impacting communities of color, and in light of the public protests and public calls to address racism and the police brutality we have seen following the recent deaths of George Floyd, Breonna Taylor, Ahmaud Arbery, and many others. HPIO recently released a brief that goes into detail on this relationship between racism and health. And I'm going to share here the Race Forward's 4 Levels of Racism framework, which is a framework that we shared with you before about a year ago now. We found this to be a very useful tool that others can use as well to better understand how racism takes shape in society. I'll just review these levels again with all of you. So if we start at this first rung towards the bottom, that's internalized racism, and describes an individual's privately held beliefs of prejudice, oppression, and privilege regarding their race or the race of others. includes feelings of white superiority or a person of color's feelings of inferiority. So for example, a person of color may have negative feelings or views about their skin color or features because they've been held to white standards of beauty. Additionally, a person who is white may hold their whiteness as superior to or more attractive than persons of color. And then we move on to what is considered interpersonal racism. And that is what is most commonly thought of when we talk about racism. It is the stemming from the privately held beliefs that come out through action or interaction with one another, acts or beliefs of racial prejudice, stereotypes, oppression, or privilege. It can be both indirect or direct and result in unfair treatment, bias, or violence. Then we have institutional racism, and this is when beliefs of racial prejudice, oppression, or privilege are acted on or perpetuated by institutions or organizations. This is where we see fewer people of color being hired or promoted to positions of leadership within an organization. And then that top rung there is structural racism, which occurs both within and across systems in our society. And structural racism leads to things like disinvestment from communities of color through historical practices of residential redlining and even present-day gentrification. Most conversations on racism do focus on that interpersonal level. However, systemic racism, which is institutional or structural, is really an even more pervasive driver of the poor outcomes faced by communities of color. The figure that you now see here outlines the relationship between racism and health, and the connections are incredibly complex and interwoven. Racism impacts health both directly and indirectly through exposure to traumatic events, violence, toxic stress and stigma, increased risk for unhealthy behaviors, and policy and system inequities. I'd like to break this down a bit more for you, first by providing an example of how racism through trauma and toxic stress impacts the health of communities of color. Toxic stress results from a prolonged activation of the body's fight or flight stress response system and can be caused by experiencing traumatic events in life, including experiencing racism or racial microaggressions. National data indicates that Black children are 9 times more likely than white children to be treated unfairly due to their race. What research tells us is that this repeated exposure to trauma or racism can lead to physiological changes to the body that cause a wear and tear effect on a person's nervous or endocrine and immune systems. And over time, as you can imagine, this wear and tear effect contributes to poor health outcomes, leading to things like high blood pressure, heart disease, stroke, depression, and even premature death. People who are exposed to chronic racism are also more likely to engage in unhealthy behaviors as a way to cope with the trauma and toxic stress that they are experiencing. Engaging in unhealthy behaviors can actually even have a protective effect on a person's mental health in the short run. However, of course, as we know, engaging in unhealthy behaviors like not eating healthy or smoking are significant contributors to poor health outcomes. The graphic on your left shows that the more trauma or adversity a person experiences early in life, the more likely they are to smoke. Traumas like experiencing racism. And to illustrate the impact of this, on the right, you see a bar chart that shows that middle-aged Ohioans who are Black are twice as more likely to smoke than white Ohioans. Racism also leads to a number of policy and system inequities, which then contribute to poor health outcomes for communities of color. So for example, Data demonstrates that communities of color face implicit biases and racial discrimination within the healthcare system, and that they're underrepresented in the healthcare workforce. Black patients were often denied treatment in the past because of their race and were subject to racist and unethical medical research practices, such as the Tuskegee study, which is the picture that you see here, an experiment of untreated syphilis in Black men that lasted 40 years. Even in clinical care today, studies have found that many white physicians implicitly, so not with conscious knowledge, hold anti-Black beliefs. This may manifest in things like writing off some of the health concerns and questions of patients of color, or not taking their complaints of pain as seriously. A survey that was conducted in 2016, so relatively recently, found that 58% of medical trainees incorrectly believed that Black skin was actually thicker than white skin. For these reasons, people of color have understandable mistrust of and are less likely to engage with the healthcare system. And a recent National Kaiser survey found that nearly 6 in 10 African Americans do not have trust in the healthcare system to do what is right for their communities. We also see that there are inequities within the criminal justice system that are deep and systemic, dating back to slavery, Black codes, and convict leasing. Black codes were criminal codes meant to restrict the activities of African Americans, and convict leasing was the practice of leasing incarcerated people to plantations and factories after the Civil War. These inequities were also rooted in more recent history, including the war on drugs, where from the 1960s to the 1990s, there was bipartisan support for a series of tough on crime policies. And these policies resulted in dramatic growth of our prison population, termed as mass incarceration, and that disproportionately impacted men of color. Nationally and in Ohio, Black and African American people are incarcerated in state prisons at more than 5 times the rate of white people. Despite this large disparity in drug crime arrests by race, drug use and addiction prevalence are actually relatively similar across racial and ethnic groups. And what we find is that incarceration limits opportunities to health for people of color through increased exposure to trauma, disease, chronic stress, social stigma, exclusion, and also by creating barriers to accessing employment and quality and affordable housing, which can then have a rippling effect on not just the health of that individual, but also impact the financial and social stability of their families and their communities. Racism has put in place and maintained obstacles to health for communities of color in the US for more than 400 years, and work to address the cumulative impacts are daunting, but improvement is possible, as you hear us frequently say here at HPIO, and that's the truth, and there are actions we can all take. To support efforts to eliminate racism, HPIO adapted that 4 levels of racism framework I shared to create these action steps to eliminate racism and advance equity. The diagram outlines how individuals and groups, public and private organizations, and state and local government leaders can work to eliminate racism in all its forms and advance equity. There are also action steps that you see here associated with that diagram that all Ohioans can act on to eliminate racism. And I want to highlight a few key themes from these action steps. Of course, there's certainly more in the brief. A necessary first step is to publicly acknowledge racism as a crisis, and this means ensuring that your organization has a specific public statement acknowledging the need to dismantle racism and address its impacts, and that the statement moves beyond references to diversity, equity, and inclusion to include an explicit naming of racism. By doing this, you set a level of honesty and accountability and authenticity that is really important to engage in equity conversations. Another critical action step is educating yourself and others on the impacts of racism and ways to take action. This could be requiring staff participation or engaging yourself in implicit bias and anti-racism trainings, or cultural and linguistic competency and cultural humility trainings. Another key theme is making sure that the policies and practices you are implementing result in equitable outcomes for communities of color. It is necessary and critical that specific targets are set and progress is tracked over time. This requires evaluation and the collection of race, ethnicity, and culture data to ensure progress is actually being made. I also want to highlight that there are many opportunities to advocate for, implement, and fund anti-racist policies, programs, and practices both within your organization and through your positions in communities to influence public policy. Here are some critical action steps you can take within your organizations, and I'll just give you a few seconds to read this and highlight a few of these action steps. You may have an opportunity to impact racism by taking a look at your healthcare purchasing decisions. You can also further racial justice initiatives through your corporate philanthropy or organizational philanthropy, and making place-based investments and supporting minority business enterprises is also critical. Of course, there are also many opportunities, as you've heard us say over the years, to address and make change through public policy. These documents offer many public policy recommendations to advocate for and align with, including the State Health Improvement Plan, the Minority Health Strike Force Blueprint, and the DeWine administration's executive response. In April, as Amy has shared, Governor DeWine formed the Minority Health Strike Force to address the disproportionate impact of COVID-19 on communities of color. And that strike force issued 2 reports, an interim report with recommendations that were specific to eliminating COVID-19 disparities, and then a blueprint which provides a comprehensive set of recommendations to eliminate racism and more broadly address health disparities in communities of color. And that blueprint, HPIO was contracted to facilitate development of. And in response, the DeWine administration released an executive response that outlines policy actions that state agencies can take to advance equity and dismantle racism. And then here are additional public policy focused action steps that can be taken. Again, I'll just pause, give you a few seconds to review these. Of course, we at HPIO can't emphasize enough the need both for organizational change and change at the policy level or public policy level. Among steps that can be taken are normalizing conversations about racism, showing that you are comfortable with feeling uncomfortable about the historical facts that have led to disparities and inequities. Examining your government relations agendas through an anti-racist and equity lens. And what we've found to be so important in our discussions, both in creating the documents, the SHIP that you see here, and in the Minority Health Strike Force Blueprint, is that there is a need to partner and collaborate on policy advocacy, working hand in hand with communities of color. To overcome the status quo, it is necessary that these steps are taken and these themes are acted on and sustained over time. It is not going to be a one-time solution or action, but really there needs to be a more iterative process to take take action. And we have been very encouraged in recent months to see so many leaders across sectors make bold statements, drawing the connections between racism and health, and are very optimistic about our chances to improve as a state. So I'm happy to take questions if there are any questions, but we would also like to engage in some discussion.